That was, to date myself, but that was my junior year of high school. I had a goalie dive at my knee, bent the wrong way, tore the PCL, tore the MCL, and then my junior year of college, I did the ACL, and then playing in a women's league in Long Beach, I did the MCL again. So very passionate about helping athletes get back to playing. And after I was injured with all of my injuries, nobody looked at anything other than my knee. It was just, is your range of motion back? Is your strength back? Great, go play. When I tore my ACL in college, and I'm not saying this is good at all, I should never have done that knowing what I know now, but I was playing soccer 4 months later, collegiate soccer, which is silly, but nobody ever looked at anything else. But I couldn't help but think that maybe somebody looked at my ankle and realized how locked up it was, that when I stepped to shoot a soccer ball, my ACL wouldn't have tore. So that's me, that's why I care.
All right. Welcome to the show, Dr. Lisa. It's so nice to actually see you, and it's kind of cool that we get to talk before you produce or you're at Pro Sports. So this is kind of cool to get to know you. Um, One of the things that on your topic, you talked about rotational athletes, and you know I keep hearing this term rotational athlete, and in your words for the audience, what does rotational athlete mean?
Yeah, it's funny. I think about that quite a bit, where it's like everything really has a rotational component to it. So a rotational athlete is any athlete who uses their body in a rotational manner, I guess, something simple as that. When I was putting together my talk for the upcoming Pro Sport event, I was just kind of updating some of my slides, and I was putting, there's a lot like rodeo, that's rotational. Like they're on those giant animals, and you aren't able to rotate your your thoracic spine, you're gonna have issues. So yeah, even
Right,
darts. I think like
right.
darts is even that's there's a rotational component to that. So I say rotational
Darts.
sports a lot, but it's all athletes. It's just
Oh,
So basically, Spencer's okay being in Florida with shuffleboard.
hey, there's some rotation in that.
absolutely.
I know. That's what I mean.
Oh,
That
yeah.
twist.
Shuffleboard. Although, before we got on, I was talking with our engineer, David, and we tried to go through all the sports that were rotational and or not. And believe it or not, we thought of swimming breaststroke or butterfly. I guess there's no rotation in that. I mean,
Yeah, there is because in the dolphin kick, you'll get a
oh,
rotational component at that thoracolumbar
oh,
junction,
oh, oh.
and you'll get rotational at the hip with the butterfly
Well, I
kick.
challenge our audience to come up with a sport that has zero rotation. Maybe chess or checkers or something like that. Okay. Well,
Sleeping.
right, even that. Dr. Lisa, I want to ask you. You're both a athlete and a chiropractor, and how does that affect how does that influence how you treat people?
Oh, I think, at least for me personally, it helps tremendously. I understand the athlete's brain, and I've had so many injuries that I understand wanting to come back. And I was a soccer player, and I've torn ACL, PCL, MCL. I missed my junior year of high school, my junior year of college with knee injuries, and so I know what it's like to want to come back. I know what it's like to have to be patient. I know when it's time to push it a little bit more than you normally would. I think being able to relate to the athletes when I speak to them, it helps tremendously.
Yeah.
It's not a cookie cutter at all type of treatment, because, well, one, everybody's different, but then two, it's like I really relate to them. Am I treating a high school senior who's just has one or two more games and then their career is over and they just want to finish the season, or am I treating a young kid who wants to play professionally someday and could mess something up seriously if we push it too hard? So I think really having that athlete mentality and understanding them and their sports is helps tremendously, and it gains trust also, which, as you know, is huge.
Yeah, the mentality of an athlete slash doctor is definitely could connect with and inspire the patient to heal better. Actually, I had read an article many years ago about how athletes make the best doctors because they're used to a challenge, they overcome obstacles, and their process of thinking is differently than an average. So good for you.
Yeah.
Please explain this concept of rotational athlete and joint by joint theory and your understanding of it.
hmm So I'll go back a little further. So when I was practicing for, I don't know, probably 5 years. And then I went and I took a class at the Titleist Performance Institute, which, if anybody listening is interested in working with golfers, the TPI is beautiful. It's in Oceanside, California. That place is amazing. They're adding a baseball facility to it. Highly recommend it. But it changed how I practiced. I was listening to Dr. Greg Rose talk about the joint by joint approach and how if one area is locked up, the body will compensate. And I just kind of had this aha moment where it was like, man, when I tore my ACL, I stepped to shoot a soccer ball. Nobody ever looked at my ankles. Nobody ever
Mm.
looked at anything else. When my knee was strong enough and was moving well enough to get back to playing, I was playing. I was playing in a. I am aware this is stupid now, but at the time, it seemed like a great idea. I was playing collegiate soccer 4 months after I tore my ACL after surgery. Um, but nobody ever looked at anything else. I
Mhm.
had my surgery within that week, so I didn't lose too much range of motion, didn't lose too much muscle mass. So, um, yeah, so that kind of just got my brain going, and I took a full dive into this area. So then, just going back to practice the next day, working with not just my athletes, but all my patients who would, especially the ones that I've been treating for a while that had like the back pain that just kept coming back, kept coming back. And it's like, oh, well, let me look at other areas a little bit more than I was before. And it was like this magic trick. Well, I'll treat something seemingly completely unrelated. And they're like, oh, well, my back feels better. My shoulder feels better. It's like, so it's fun also,
No, I think that's
but
great. Yeah.
powerful.
It's unfortunate, but when an athlete comes in with an injury, let's say a knee, most physicians, that's medical and even some chiropractors that don't specialize in sports, they don't pay attention to the good leg because they've been, they're so focused on the injured leg. And the good leg, you've been putting all your weight and pressure and athletes, aren't they tremendous at compensating?
Mm.
They're sensational compensators, which again could be end up being a bigger problem. What are some of the common functional limitations that you see in sports that you know you'll apply your key assessments to?
Yeah, so my two demographics that I see the most are baseball players, especially pitchers, and
Mm,
golfers. So I
yeah.
only have one bull rider, so maybe that will increase after this event. Um, so I see the number one thing I see by far is just thoracic spine. It is locked up. Everybody's sitting in this position all day where they're all hunched over and they're on video games and they're on electronics and they're on their phones. Especially my high school boys, it's like they come into the office and they're already in this slouch position, and it's like, how can you sit like that all day? And then all of a sudden, you want your arm to go in this extreme motion. So, thoracic spine would be number one for me. And I mean, that's not just my athletes; that's all
Yeah.
of my patients. So many desk jobs, and even worse after COVID. And then I
Mm.
see a lot of hip stuff with my golfers and baseball players. Uh, Hips get overlooked a lot. So that would be my top two that I see personally. Very simply, I will say I'll have the patient turn their back towards me, and I do this with every single patient. Feet together, turn as far as you can, and I want to look, if I'm standing right behind them, I should be able to see their opposite shoulder. So again, here, hold it, I should be able to see the shoulder. When somebody goes like this, they're not rotating enough, they can't move enough, and that's so many of our patients. If you treat golfers, weekend golfers with low back pain, we need to check the thoracic spines and the hips, for sure.
Yeah. I mean, as I said, they're such huge compensators. These athletes, did they come into you to for like a well check or performance, just for peak performance purposes, void of pain?
hmm I wish that what it was,
Yeah.
because that's the fun stuff. I'll have guys come in, like pitchers or golfers who have like a big golf event in LA that weekend, or they're here playing the Dodgers or Angels, and so they'll come to me just to get them ready, make sure everything's moving how it's supposed to, just to get them ready. That stuff's fun when they're not hurting. I have a big net set up in my office, so I can watch my athletes hit, swing, throw. I've got a K vest so I can hook up my golfers and baseball players and really get nerdy with their kinematic sequence and all the day. Like that stuff is a lot of fun for me. I could talk about that all day, get super nerdy about
That
that. That's fun. But unfortunately, a lot of times they come because they're injured and they want to get better. So that's what I see first, and then they're like, oh, this is different. What is this net for? What, this isn't like other chiropractic offices that I've been to. So they usually come in first because they're injured, and then we go from there.
What's a K vest?
The K vest is a bunch of sensors. So there's a sensor that goes around the waist, around the back, around the arm, and it's for baseball hitting and for golf. And when the athlete swings, it measures, it's 3D motion capture. So it's measuring where their body is in space, what they're doing. It compares that to professional levels, and it also measures their kinematic sequence. So making sure they're generating their power from the ground up and in an efficient way.
So for the audience that's listening, doctors and non-physicians, beyond pain, do you teach them about performance, and then the understanding that pain is just the fire alarm, and then shutting off the fire alarm, and then you could use your kinematic studies to exemplify where they could be or where they're not yet at?
Yeah, and this kind of goes back to the athlete mentality. I really try and read the athlete, and if that's the message that I feel like they need to hear, then yes. It's like some of them don't care about pain. They just want to be able to hit the golf ball further than their buddies on the weekend. Like it's just more, I guess, for me about what that particular athlete wants, why they're at my office in the first place, and then I will speak to them in their language and let them know how all this stuff can help them.
So, on those upper lower cross syndromes that impact the athlete, right?
Mm-hmm.
What's your best strategies to manage these, and how do you go from assessment? What kind of treatment and what kind of rehab do you suggest for them to take home?
Mm-hmm. So to answer that, I would say everything is very individualized for me. But that being said, most people just need to move more. So just telling people to
Right.
get up and move, and maybe do the opposite of the position that they're in all day on the computer. So it depends on who I'm treating. So if it's just one of my everyday patients who has a desk job and hurting, it's a lot of the basic stuff like that. If it's a higher level athlete, I will give more specific exercises and stretches. There's a couple of my go-tos that I'll probably go over at Pro Sport. I'm a big fan of getting people up and moving when I'm speaking, so I hope I only have an hour to speak, but I hope to leave plenty of time for getting people up and moving. And I usually do a couple of the big assessments that I do, and then hopefully a couple of the corrective exercises that I'll give to my patients. And it's cool because some of them you see an immediate difference in like what mobility, for example. It's like you can do something that's pretty quick and easy, whether you're a high level athlete or you're a desk job person. We It's move it or lose it, right? We want things to keep moving. So uh, yeah, so I'll demonstrate some of those there, hopefully, and yeah.
So a new patient comes in to your office. Let's say they're let's go with a pitcher or even a quarterback or something like that. They come in. What's the first thing can you just bring us through some of the things that you would do that may be different than most physicians do?
Yeah. So first, I have them fill out all my intake stuff online before they come, so I already have a little bit of an idea of what I'm working with, who I'm working with. And then when they come in, I have them sit down first and I just talk to them. Why are you here? How can I help you? What do you want? Like knowing their why, because it's usually so much more important than, oh, I hurt my ankle. It's like,
Yeah.
okay, well, why is it important for you to play again? Like, what's your goal here? What can I help you with?
So let's say I'm gonna I'm gonna throw a complex situation at you here. Let's say they have a pars fracture at the low back, and for those that are listening, those are uh, they can be painful, but you can live with it and play the rest of your life with a fracture in the low back. I just had a patient, a soccer player, female. The doctor told her she had a pars fracture, uh, and they naturally freak out with the word fracture.
Back, yeah.
So, but back 30 years ago when I was first practicing, you would get a 20% disability on a pars fracture, and now you get like maybe a 2% disability because they've realized if you keep the muscles strong at the low back, you can still
Yeah.
play the game.
All right. I got
What
a question. I got a question. Yeah, you said the TPI kind of changed your thought process as how you looked at patients. Coming out of school, you had obviously one thought process. What did they teach you that changed your thought process?
Oh, a lot. I
Hmm.
No,
would
go
say
for
just
it.
starting with kind of the regional interdependence, where everything is connected. Um, I felt like at school it was just like, here's the condition, here's how we treat it, here's a condition, here's how we treat it. It was all this stuff that was separate, and maybe it's not like that anyway. I graduated 13 years ago, over 13 years ago, so I'm hopeful that a lot more of that is taught in school now. But for me, school is a lot of like, okay, this is what you do to pass boards, and here's your condition, here's how we treat it, here's how you recognize this condition. And I didn't get as much of the like, okay, well, here's an ankle injury, and uh, here's other reasons than just rolling your ankle that maybe there's pain or dysfunction in the ankle. So this is not just with my athletes, this is with every patient. I'm in LA, I see a handful of car accident patients also to really help them get better. I want to make sure everything moves how it should. I swear, like, how many people do we have that sit at a desk all day and then they get shoulder injuries or elbow injuries, and it's like, yeah, there's low back injuries. It's like, well, yeah, your thoracic spine doesn't move. Every time you move and rotate, you're putting stress on other areas of the body, because the thoracic spine is where we're supposed to get that rotation from, not as much the lumbar spine. And for our athletes, this is especially important because when that pattern is correct, this is where we get the potential for the best elastic energy. That's why I think the small golfers that can absolutely crush the ball are a great example. Like Ricky Fowler he can crush the ball. He's a little guy, but he's got strength where he needs it, and he's got mobility where he needs it. So it's like a coil. He can just whip himself so far forward that the ball just crushes it. A lot of the movement stuff, we're looking for restrictions, but sometimes you can be hypermobile too. So I'm not going to get too much into this, but just something to keep in mind. There's plenty of people who come in and they're moving great, but it's like, oh, you're moving a little bit too great. We need to stabilize some areas for you. Or not for them, but recommend stabilization stuff. So if you lock up a joint that is supposed to be mobile, the body will find somewhere else to provide that movement.
So golf is very popular, especially out here in Southern California and Florida, especially during the winter when people are on break and all that. What do you see that you learned at the TPI that now that you look at people before they have an injury, that you can go, you're going to get this because you have this?
Mm-hmm. A lot of times, and I'm in Southern California too, and I try and golf also. But a lot of times it's just people are trying to get their bodies to do things that they can't do. They see professional golfers on TV doing certain things, or they'll go take lessons with a coach who's telling them like, oh, well, the best golfers in the world are swinging this way, or you need to rotate more, you need to do whatever it is more. But if their body can't physically do it, then they're going to hurt themselves or something bad will happen. So that was one of the biggest takeaways where it's like, not everybody moves like, I was going to say Tiger Woods. Tiger Woods doesn't move like Tiger Woods used to, but um, not everybody moves like Rory McIlroy. You can't just say, okay, here's this swing, see what he's doing. Like, if you want more distance, you need to rotate more. It's like, well, what if you can't physically do that? You either need to work around it or you need to work on it and improve it. Golf, you go to the swing and right at impact. If you watch golf and watch like a athlete who has like a white belt on or something, McIlroy's a great example, but you'll see right at impact the pelvis will actually tilt to get a little bit more of that power there. So a lot of forcing, and I'm guilty of it too. I want to hit the ball as far as my husband who crushes the ball, and it's like I need to remember that it's okay.
That's true. What do you see a lot of mistakes being made from the amateur? Um, do you think it's a common mistake that maybe people don't think about?
That people don't think about. I think a lot of my high school golfers will hit off at the driving range off a mat way too much, and I think it's hit a ball, 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 and it's the ground is hard underneath, and that is not how a actual golf game is. You're not hitting the ball that fast and that often, so I'll see wrist injuries and stuff like that from uh, too much, and to be like, okay, pick your shot, take a break, hit off the grass if you can. So that's one that I think a lot of my younger golfers don't think about, don't think that that's an issue, which it is. A lot of my older, and I say older, I'll include myself in that, like my athletes that aren't kids anymore. I'll be 40 next year, so I can say that now, right? That's old. Um, so
Then I'm ancient.
they will do like a really quick warm up, and it's like, okay, well, our bodies don't move like they used to, and they think, well, if we either hit a couple balls before or just uh, go up to the first hole and do a couple stretches, couple swings, like, yeah, okay, I'm warmed up. It's like, no, you're not. I wish I could get warmed up that fast, but things don't move like
Don't
they
you
used
see a lot of don't you see a lot of golfers? They'll go and on a lunch hour and they want to practice, but they'll I'm always talking to my golfers. I'm like, you just went and hit a large bucket of balls in a half an hour, and and 80% of those was using your driver, and yet in a real golf game, you'll maybe hit your driver 14 times in 4 hours, and you'll hit your for par threes, you're not going to hit your drivers, and some guys for par fours they won't even hit the drivers. So do you find that a lot of them, and then they wonder why their backs hurt, their hips hurt, their this
yeah.
hurts because they just did so many rotation, which is what you were just alluding to. Have you ever, one things I do is I'll give golfers, I go spend, if you have a half an hour, just go to the putting range, because you lose more scores on the short game than you do in the long game. What are some tips of warming up if they only have a half an hour lunch? What are some examples that you will teach your people?
Mm-hmm. I just tell people to make sure the body's actually warm. Like, even if you're going to a driving range that has stairs, go up and down the stairs a couple times. Like, actually get the body
Hmm.
warmed up. I think a lot of times that's more important than a couple quick stretches. Make sure the body's warm. Get your heart rate up a little bit, and then do that stuff. And just going to practice putting is just not as much fun as crushing the driver. So I get that. That's why you need a putting green in my
Right.
office or in your office, like I do. So that's
Oh,
the better
there you
solution
go.
there, right? Just put it in your office. Um,
Do
but
you
yeah,
have
I just tell them to make sure the body's actually warmed up. Get moving, especially if you have a desk job and you're sitting all day. To just go and do the opposite is great, but there needs to be a transition there.
do you have a favorite warm up to give these golfers?
Uh, for me personally, I'll make sure that my body's actually warm, and then I will hit some balls. But I understand that I need to resist the temptation to just crush my driver, especially if I get one good shot with my driver. I'm like, okay, I'm ready. um, but a lot of times I'll just take the golf club, I'll put it on my back, I'll turn, I'll rotate, take a real deep breath in, relax, turn again, rotate again, and just really open up this area as much as I can. Use my breath, use my just loosen up the whole rib cage, unlock the thoracic area as much as I can. That's for me one of my biggest recommendations. Because yeah,
Do you do the functional movement screen or the SFMA on everybody that comes in first when they come in? And you look for limitations in certain areas of the body that gives you a clue to the next step
yeah, either limitations or hypermobility. I think that
or
can be just
hypermobility.
as
Yeah,
much
yeah,
of a problem
yeah.
as the limitations, and that always
Mm.
surprises people. Like, oh, I don't know why this hurts. I move so good. I have a new patient right now. She's 80 years old. She just started golfing not that long ago. She has 4 hole-in-ones already. 4. She is like a
What?
legit she comes in, and like if she's like hooked up to a machine and I open the door and check on her, she's like, oh, sorry, I was playing golf in my head. She is like obsessed. So she went from like didn't play to like crushing it. But she moves really well. She's like, I don't understand, because her shoulders were hurt a little bit. She's like, I don't understand why things hurt. Like, look how good I move. And I'm like, you move fantastic, especially for somebody who's 80. I'm like, but you aren't as strong as you need to be. So incorporating a little bit of strength training for her, little basic stuff, is, I'm like, not only will this is the extra fun part. Not only will it help you feel better, but it improves your golf game also. But I saw her yesterday, and she said she was golfing today, and she joked about getting another hole-in-one. I'm like, can I get credit for that one? You already have 4. I've never gotten one. Can I just like? Yeah, it's crazy.
That's crazy.
How,
Yeah,
how old?
she's
How
80.
old did you?
I don't know when she started playing, but it wasn't that long ago to get 4 hole-in-ones. She's like, I don't want to get any more. My friends get mad at me, and I'm like, bet I'm mad at you.
No way.
Good Lord.
That's
You know, Spencer, there's hope for you, man.
I know, 80. That's pretty good for 80. I've never played a day of golf in my life, by the way, so that's another story. You know, our obviously our mainstay is spinal and extremity manipulation, and I always say to be a black belt 10th degree in that
Yeah.
because nobody else can do that. Terry, I know I can't say that enough. That's our mainstay. Anybody can do anything else, but especially when you're in an environment
I was
with
just hoping you threw that. I was just hoping you threw the black belt out there.
yeah, be a black
The
belt,
10th
10th degree.
Yes. And I do adjust almost all my patients. I know I'm talking a lot about all the other stuff I do, but I think the adjustment's the most powerful, absolutely. So I do adjust
Totally.
almost all my patients.
We're going to go into one of our favorite segments of our program, and it is going to require you to be on your toes for this. It's called the rapid fire questions. Don't worry, I know you have the answers to each of the questions in your mind, but it's going to be like a one-word answer or a one-sentence answer. I always say that, but we end up we end up elaborating on something that you might say that's really cool.
Okay.
There's 5 questions, and let me know if you're ready. Oh, good. I'm glad you're getting a drink of water.
I'm
All
ready.
right.
Bring it. I like the challenge.
Yeah. Rapid fire question number 1. What is the one movie you could watch over and over again?
Billy Madison or Happy Gilmore?
She was ready for that. That was beautiful. That
I
was
thought it was going to be a
beautiful.
sports chiropractic question. It was not a sports chiropractic question.
No.
Okay.
No, these are. Question number 2. What's the one thing people would be surprised to learn about you?
Oh, man. I don't know. Surprised to learn about me. I'm pretty boring.
Hold up your right arm. What does that say?
It says, where God guides, he provides.
All right. Do you wear long sleeves often?
I'm in Southern California. I,
Oh,
I'm wearing a sweater right now. It was freezing this morning. It was like 60 degrees. It was like in the 50s. It was really cold. Um, no,
what inspired you to get that tattoo?
I got it right before COVID. My grandfather passed away. He was 95.
Oh,
In it exactly a month later, my grandmother passed away. She was 95. And in between that, my grandmother's twin sister passed away. So it was pretty crazy. All at 95, my grandfather, uh, my grandmother's twin sister, and then my grandmother. And at first it was hard, even though they were 95 and lived a great life. To lose two grandparents, it was hard. But it was right before COVID, and they're in New York. So I wouldn't have been able to see them. We wouldn't have been able to have a funeral. Like my mom and my aunt wouldn't have been able to see their parents because they were at the end in a nursing home. So it was a blessing in disguise. And I get all personal here. I have other tattoos, but they're hidden, and I like them though. So I was like, oh, COVID was like, okay, life is short, and I want to get one that can be seen. And my aunt sent me a necklace that said this on it, or God guides, He provides, and it was right. It was my grandmother's. She sent it right after she passed away, and I was like, I thought you might want to have this, and I'm like, that's it. That's what I'm getting tattooed on me.
Aw.
So I had a guy come to my office because in California everything was closed for a long time. So he came to my office and tattooed me at my office during COVID.
well, that was a
That's
great
awesome.
answer to the second question. That was good. That's why I figured, I wonder if anybody knows about those tattoos. All right. So here's question number 3. Where would you wish you could buy a one-way ticket to?
Oh man, these are hard questions. I've traveled quite a bit. I don't want a one-way ticket anywhere. Hawaii. Hawaii. I was in Hawaii 2 weeks ago again. I can
Oh,
relax there so much better than anywhere else.
there you go.
Yeah.
There you go. There you go.
All right. Question number 4. You ready? If you could go back in time and meet someone, who would it be and why?
Back in time, indicating that like anybody, no matter dead, alive.
Yep.
Goodness gracious. I don't know. The first person that comes to
Jesus?
mind is
No.
Tiger Woods. I have so many questions for him.
Oh.
That's the first
All
person that
right.
comes to mind. So I'll go with
No
that.
kidding. Okay. All right. And
What part
w-
of his life would you go back to talk to him at?
Oh, I'm curious about his back
when you
issues
got
and like what he was told, if he was ever told like, hey, you can't keep doing this or you're gonna have back issues or stuff like that. If that was the case that he was told like you need to change something and he said I'm the best golfer in the world, why would I do that? If that was a regret, if he regretted not changing, like there's just he's a very interesting person, I think. Can't imagine
Mm-hmm.
so much of his life. So, and I
Yeah,
think too, as an athlete myself, just the mentality of such a high level athlete is just curious. Also,
great. Question number 5. When you travel, what is the one thing you always have with you? And not a toothbrush.
I feel like it's my kids. Probably one thing I always have with me. My running
That was
shoes.
good.
Even if I don't get to go for a run,
Ooh,
I at least
good one.
take them with me in hopes that I get to run in a cool new spot. So
Very
that's
good.
number
Very good.
2.
All right. Back to our very good. Thank you. Those were interesting personal questions. Now we're going to go back to our regularly scheduled programming.
Okay.
W- Once an athlete has been rehabbed, maybe from an injury or just some of the things you might find that require some maintenance. Can you offer to take their what tips would you offer to take their performance to the next level? Now, you could use a isolated circumstance, or you can do a general perspective, but we would love to hear what you would do to, as far as tips.
Yeah, and again, it really just depends on what the athlete's goals are. A lot of times I try, since I see so many baseball players, I'll just use my high school baseball players I see a ton of. So they come in, they're injured, we get them back playing and feeling good. And then it's like, okay, now let's talk about like maybe why the injury happened in the first place, or what can we do to get you to hit the ball a little bit further. And I don't like to. I think there's a little bit too much focus right now on baseball pitchers at a young age throwing, and
Mm.
so I sometimes will
Mhm.
talk about what else can we do that will help you throw better. That's not related to your arm. Is there like different leg exercises or stretches or something that is actually going to help you be a better athlete, but we can take some of the pressure and some of the stress off of your arm? How about we build a good foundation first before we throw in things like weighted balls? Like weighted balls could be great, but if the foundation's not there, like what are you doing? You're gonna not good. So a lot of like just kind of making sure the foundation's there, and then go up from there. If they have that, especially when they're young, and then you can make sure everything's just moving efficiently and they're doing things the right way, then sky's the limit, and then they can play much longer.
Uh, we are talking about athletes. We could be talking about families or first responders or anything like that, but you like to emphasize a kind of a more of a teamwork approach to patient care. What does that look like to you?
Well, I say, and a lot of this is like right from my talks, but I tell in every talk I give pretty much, I say leave the letters after your name out the door. Like it doesn't matter. If you truly care about what's best for the patient, then you're going to work as a team with everybody else involved, whether it's the athletic trainer or orthopedic surgeon or massage therapist, or what their strength and conditioning coach, whatever it is. And don't have an ego. Listen to everybody and understand that you can't fix everything. This one, and this is basically just getting permission from the athletes to talk to their team, whether that's their coach or their orthopedist or their massage therapist or whoever it is. I want to get permission to talk to everybody so we can all be on the same team, all be on the same page. If I'm telling an athlete not to do something and then he goes and his strength and conditioning coach is having him do the opposite, there's a problem there, there's a disconnect, and without permission, obviously, we can't ask those questions and have those conversations. So get that permission, do it right away. And I don't think I've ever I had one guy say no, because he didn't want his coach knowing that he was hurt. So that's about it. Another side note, that's one of my other tattoos. On my ribs, it says, "The secret of the care of the patient is in caring for the patient." I got that right before I graduated Palmer, Florida. And it's backwards, so I see it in the mirror. Yep. Yeah.
Ooh, that's good.
So, but if that's like,
I like that.
that's our goal, right? Is to help
Yeah.
our patients as much as we can, do whatever we can. And sometimes helping them in the best possible way is by saying, hey, you should go see this person instead of me. I'm not the best person to help you. And being okay with that, I think, is important. Leave the egos at the door.
Huge. Actually, that's that's one of the mottos that the creator of pro sport used to always say to us, right, Dr. Terry? He
Mhm.
would always say, "Leave your ego at the door."
Awesome.
Meanwhile, he would bring his ego in, but that's another story. Anyway, but the I think that is fantastic. I would have definitely got that tattooed on my neck for everybody to see.
Not too late. You
That
can still do it.
right?
We'll do it in Vegas. I'll go with you.
Yeah, yeah. After a couple tequilas,
I'll pay for it.
right?
You're gonna
That's
have to
awesome.
hold his hand so he doesn't scream like a little girl, and I'll pay for it.
Jeez. Yeah, we'll talk about that tattoo thing on another another event.
So, For the listeners out there that are thinking about becoming chiropractors, what advice do you give them?
The first thing that comes to mind is that it's very expensive. uh, so just to keep in mind, student loans are a thing, and to pay them off, because I was like, oh, I'll wait and pay these, and then they go up. So that's, to be honest, the first thing that comes to mind, because that is very real. But that being said, my hair paid off, so I'm okay. But I would say go shadow chiropractors. Go see. There's so many different styles. There's so many different ways to practice. There's a lot out there. So to go see what others are doing. And chiropractors are like, for the most part, they're like the nicest people. They're very willing to let people come in and shadow them. I shadowed a chiropractor before I went to chiropractic school, and I'm like, man, this guy helps people feel better all day, and he loves it. Like, this is great. It was like, from that day on, I'm like, this is what I want to do. This is awesome. And as an athlete, it all makes sense to me, and it got its benefits too. I mean, I did a 5K on Thanksgiving, a little turkey trot, and it's like, well, then I have all the good supplements for recovery that I get discounts on, and just all the recovery tools at my office, and my Normatec pants I can put on if I'm sore. Like, it just goes well. So there's those benefits too. But yeah, go shadow people, go talk to people, reach out. Most chiropractors that I know really enjoy what they do and are willing to talk about it.
Super good. I thank you, and we thank you for your time, and we'll look forward to listening to you lecture in Vegas
And tattoos
next week. Yeah, and maybe. I'll fill you in on it. My son has been he's been wanting me to get one, but we'll talk. We'll talk about it. All right. Thank you so much again, Dr. Lisa. I appreciate you. You've been wonderful.
Thanks for having me.
Thank you very
You
much.
bet.
Take care, Lisa.
Thank you for listening to today's episode of the Crackin' Backs podcast. We hope you enjoyed it. Make sure you follow us on Instagram at Crackin' Backs Podcast. Catch new episodes every Monday. See you next time.